Hello, I'm Dr. Vipul Patel from the Global Robotics Institute. If you're hearing this video, most likely you have or are about to have prostate cancer surgery with me and my team. And so I wanted to give you a little bit of introduction of what to expect. Prostate cancer obviously is a very serious disease, and it really affects the whole family when the man gets prostate cancer. And so we do take a very holistic approach to taking care of not only the patient but all of the families, from before sometimes they're getting diagnosed to during the diagnosis, the surgery, and then obviously after. And the point really is our care really doesn't end at surgery, and we think that everything that happens after is just as important, because the overall goal is not only to get rid of the cancer but to get you back functioning and back to your life. In order to do that, we have a large team. I have a very large, excellent, supportive team that includes many individuals who have expertise even beyond me in many of the things that they do. And so you'll meet various members of our team over the next years, and they will help with things like continence and potency and maybe even diet. And so I think all of these different aspects of the care that we give you from now on are important. I would like you to participate and really help contribute, and obviously give us feedback on how we can do it better. Thank you so much.
Hello, and welcome to Dr. Patel's post-op discharge class. My name is Michael. I'm Dr. Patel's nurse coordinator here in the hospital. What we're going to talk about today is everything that you need to know to take care of yourself, take care of the catheter for the next few days while you have it. Everything we're going to talk about is written out for you. I'll show you where to find it in just a moment. However, during your stay, if you should have any questions, please feel free to reach out to your nurse. Now, before you leave the hospital, there are 3 prescriptions that you need to stop by the pharmacy to pick up. The first one is tramadol. That's going to be your pain medication. We also want you to make sure that you are taking extra strength Tylenol, 2 pills every 6 hours. If you're having no relief from the Tylenol, then you can take the tramadol. The second prescription is for Colace. That's your stool softener. You're going to take that twice a day for 7 days. Starting tonight, we'll give you your morning dose before you leave today. Lastly, the third one is Levaquin. It is an antibiotic. It is only 1 pill that you will take the night before the catheter comes out. And of course, all of the instructions are on the bottles for you. Before you are discharged, we will remove the heart monitor, and Dr. Ahmed will come by to see you. So if you have any questions about any of your home medications, especially if you're on any blood thinners, so anything like Coumadin, Warfarin, aspirin, Plavix, Eliquis, anything like that, please make sure you talk to him before you leave so you know when to restart those. In your room, there will be a folder called My Care. Your nurse will review its contents with you. However, it is imperative that you take the folder home and review prior to your initial post-op appointment. And the first page looks like this. It's going to have the information for you to come back to have the cystogram and possible catheter removal. We will fill this out with you when we do your discharge paperwork and give you the appointment date and time. Please note that it is very tightly scheduled at Dr. Patel's office. It is a long visit, so please make sure you try to arrive on time. If you are too late, they will have to reschedule your appointment. The second page is a letter from Dr. Patel. The third one is a booklet. It says going home after your robotic-assisted prostatectomy. This is everything that we're going to talk about in class today. So if you forget anything I tell you, this is where you can find it. The next page is another booklet. It says penile rehabilitation therapy, medication Q&A. This is all of the information about the Viagra and Cialis. So please make sure you read through this before you come to the catheter removal visit, because at the visit, they will have you choose which medication you would like to use. The next one is another booklet. It says what to expect after catheter removal. This is more education that they will go over with you at that appointment. So please also make sure you read through this as well before. The last page says important dates and information. This is just a timeline of what to expect once the catheter comes out. There are also a couple of cards in the folder. The first one is optimizing your recovery after prostatectomy. The next card is our licensed clinical social worker. If you have any issues, any concerns, if you feel like you would like to talk to someone, please feel free to reach out to them. Their contact information is on the back of the card. When you leave today, please make sure that you take the incentive spirometer home with you. It's extremely important that you continue to use this. We want you to do it about 10 times an hour, every hour while you're awake. Don't do all 10 breaths at one time. It will make you very dizzy. You also do not have to wake up during the night to do it, but otherwise, please make sure that you are using it. The reason it's so extremely important is after anesthesia, we don't take the nice deep breaths like we normally do, and we don't have you as active as you normally are. So we want to make sure that you're using that to take those nice deep breaths because that's going to help prevent any pneumonia that can happen after anesthesia. We do want you to use that for 7 days. So today is day 1, so 6 more days after today. Now you also have on the white compression stockings. Please make sure you keep those on and pulled up to your knee. If they're down around your ankles, they're not going to do you any good. We do use those to try to prevent any blood clots because once again, we don't have you as active as you normally are. Also, while you have on the compression stockings, please make sure that you're not crossing your legs because that can restrict blood flow, which also increases your risk for a blood clot. Now keep those on. You can take them off to shower. You can take them off to wash them. Otherwise, please make sure they stay on. When you come for the cath removal visit, they will go over with you when to get rid of those. Now, speaking of showering, you can start doing that today. You can do that before you leave the hospital if you would like. Please just know when you do shower that you have the 6 small incisions across your abdomen. Those are closed with glue. You do not have any stitches. All of your stitches are internal. So with the glue, don't pick at it. It'll come off on its own. When you do shower, don't scrub the areas. Just be gentle with them and then pat them dry once you're done showering. Also, when you leave, please make sure you take the gray bucket home with you. It's very important depending on the size of your shower. If you have a smaller shower, you can just put the blue bag right outside. If it is a larger shower, you're going to take the catheter bag out of the blue bag, put it in the bucket, put the bucket in the shower with you. It is perfectly fine if this bag gets wet, you can just dry it off once you're done showering. And you do not need to disconnect the bag to shower. Now, in addition to showering, please make sure you're washing your penis area at least twice a day. We want to make sure we're keeping that area nice and clean to help prevent any infections that could happen while you have the catheter. Also in your room, you have a bag of supplies. There's another large bag like the one you have on now. There's an option for using a leg bag, which we're going to talk about in a moment. There are also some alcohol wipes, and there are these little blue packets of lubricating jelly. What you want to do is take a little bit of this, put it at the tip of your penis where the catheter is going in. What that does is it reduces friction in that area, and it's going to keep you much more comfortable over the next few days while you have the catheter. Now you can use as much of this as you need throughout the day to keep yourself comfortable. If you run out, you can go to the pharmacy, you can pick up KY jelly or a triple antibiotic ointment. If you choose to use the triple antibiotic ointment, it must be a generic brand. So CVS brand, Walgreens brand, something like that, not Neosporin. The reason for that is Neosporin has several extra ingredients in it that will make it burn. That defeats the purpose of what we're trying to do and keep you comfortable. It must also be water soluble, so no Vaseline, no petroleum jelly. Now let's talk about activity. We do want you to walk. We want you to walk about a mile a day. However, we don't want you doing it all at one time, and we don't want you doing much more than a mile. The reason for that is it's going to put a lot of pressure on the area where we just did surgery. It's going to make you extremely uncomfortable, and if you really overdo it, you can damage the surgical area. So typically what we tell patients when you're sitting at home, you're watching TV at the end of a program or commercial break, get up, walk around the room, walk around the house, maybe walk to the mailbox and back. We really just want to make sure that you're breaking that activity up as much as possible throughout the day. So also with that, if you have a longer drive home, so more than 2 hours, please make sure that you stop about every hour. We just want you to get out of the car, do a few laps, and then you can continue on. Also, while you have the catheter, there's absolutely no driving. There's no strenuous activity, so no gym, no golf, no mowing the lawn, nothing like that. There's also no lifting, pushing, pulling anything more than 5 pounds. So if you are staying in a hotel, please be mindful of your suitcases. They weigh more than you think they do, I promise you. If you try to lift through them anyway, you can pop a stitch. And once the catheter comes out, there's still no strenuous activity, and it's no lifting, pushing, pulling anything more than 15 pounds for 4 weeks. After 4 weeks, you can slowly start going back to your normal activity, and at 6 weeks, we'll give you a full clearance. You can go back to whatever you were doing before surgery. If you're still working, please talk to them at the cath removal visit about what you do for work. They will guide you as to what you can and cannot do. Now, if you have stairs in your home, stairs are perfectly fine. Just take them one at a time. So step, stop. And there's no swimming or bathing for 6 weeks. So no oceans, no pools, no ponds, no lakes, and no bathtubs. So now let's talk about your diet. So starting today, we have you on a soft diet. What that is small, frequent meals throughout the day. So instead of 3 large meals, we want you to do 5 or 6 small meals. So it can be anything like fish, chicken, hot and cold cereals, rice, veggie smoothies, anything like that in small portions. Absolutely no red meat, no fried food, or no spicy foods. The reason we have you on a soft diet is it takes several days after anesthesia for the bowels to start waking up. And during that time, we don't want to overwhelm them with a lot of heavy foods. That can lead to constipation or cause other problems. Now you're going to do this diet until you have a bowel movement. Once you have a bowel movement, you can slowly start going back to your regular diet. Key phrase there is slowly. Please don't do it all in one day. It does take a little bit of time for the bowels to fully wake up. Also during this time, please make sure you're minimizing your caffeine intake, alcohol, citrus juices, and absolutely no carbonated beverages. The reason for that is these are extremely acidic. That can be very irritating to your bladder, and your bladder is already irritated, 1 from the surgery and 2 from the catheter. We don't want to do anything to make it worse. So what does minimized look like? For caffeine, you can still have a cup of coffee, cup of tea in the morning. That's perfectly fine. Just don't drink the whole pot. Alcohol, glass of wine, drink with dinner is perfectly fine. Citrus juices, a glass of orange juice here and there is fine as well. Also during this time, it's extremely important to make sure that you're drinking at least 6 to 8 of the 16-ounce bottles of water every day. The reason Dr. Patel wants you to drink that much is during surgery, when he takes the prostate out, he has to reattach the bladder and the urethra. Right now, while that area is healing, it is still bleeding. We want to make sure you're getting that volume of fluid to keep the area nice and flushed out, which is going to help prevent any blood clots from forming that could possibly block the catheter. Doesn't have to be just water. It can be anything like Powerade, Gatorade, anything like that. You can use the Crystal Light packets, the flavor drops, anything like that. Now, as I mentioned, you're going to do this diet until you have a bowel movement. That can typically take around 4 to 5 days. It might be a little bit sooner. The main thing is we don't want you going any longer than that. So if it's been around 5 days, you haven't had a bowel movement, please call the office and let them know. When you do have a bowel movement, absolutely no pushing or straining. You can pop a stitch doing that as well. We have you on the soft diet. We have you on the stool softener. Everything should come out pretty easily. However, if you need a little bit of extra help, you can do 4 ounces of warm prune juice. Just don't overdo it with the prune juice because that can give you diarrhea, which makes you feel like you need to push or strain as well. That's the reason we say absolutely no laxatives during this time, and there's absolutely no enemas. The reason for that, the prostate sits right on top of the rectum. We don't want anything going in the rectum that could hit up against where we just did surgery and cause any damage. Now let's talk about pain. Most of our patients experience 3 different types of pain. First and foremost is the incisional pain. Dr. Patel goes in, he goes straight through the abdominal muscles, and most of our patients tell us it feels like they've done about 100 sit-ups. So over the next couple of days, try to make sure you're protecting the abdominal muscles. So getting up and down out of a chair, push off with your arms, use your thighs. Same thing in reverse sitting down. Rolling over in bed, push off with your arms as much as you can. You really just want to try to protect those core muscles over the next few days. Make sure that you're taking the extra strength Tylenol, 2 pills every 6 hours. And then if you're still having pain, add in the tramadol. If you're still having pain after doing both the Tylenol and the tramadol, please call the office and let them know. Now, when you use the incentive spirometer, that can make you cough. That's a good thing. We want it to do that. However, when you cough, when you sneeze, even if you're watching something funny on TV and laughing, grab a pillow, grab a cushion, put it over your belly, and hug yourself. We call that splinting. It really does help with that abdominal pain, especially if you're going to sneeze. The second type of pain is the gas pain. Dr. Patel goes in, he inflates a belly full of gas. It makes the surgical area easier to see, easier to work in. However, it does leave you with that bloated, distended, uncomfortable feeling. And unfortunately, there's nothing we can give you to help with that. It's not like having gas in the colon. We could give you Gas X to get rid of it. The only thing that really helps is moving around. It's another reason we want you to break up that activity as much as possible throughout the day. What it does is it starts shifting the gas so that your body can absorb it and start getting rid of it. That's going to start happening tomorrow afternoon, tomorrow evening. You'll start belching more, passing gas more. That's your body's way of getting rid of it. Now, I'm sure you also woke up this morning with your right shoulder feeling a little bit sore. May feel like you slept funny. You didn't. It's just the gas. For whatever reason, the gas loves to go to the shoulders, especially the right one. So if you are feeling that discomfort, you stretch your upper body, roll your shoulders, and make sure you're moving around about every hour or so. The third type of pain is the bladder spasms. The body does not like anything foreign in it at all, especially the catheter. So it's going to do whatever it can to try to get rid of it, including trying to squeeze it out. So bladder spasms can feel exactly like that, like your bladder squeezing, contracting. It can make you feel like you need to urinate even though you have a catheter in place. It can even feel like rectal pain, rectal pressure, to the point to where you may feel like you need to sit on the toilet to have a bowel movement, even though right now there's really not much to come out because you've been on a clear liquid diet. If you're having that urge really strongly, it is perfectly fine to sit on the toilet for a minute or two. However, after that, if nothing is happening, get up, try again later. We don't want you sitting for a long period of time because the more we sit, the more we have a tendency to try to push or strain to get things started, and we'd like to avoid that feeling as much as possible. Now, you should start feeling better later this afternoon naturally. It takes about a day for the body to get used to the catheter and stop trying to fight it. However, if you're extremely uncomfortable before you leave, especially if you have a longer drive home, please let your nurse know. There is medication that we can get for you to help with that. Or when you get home or to the hotel, if you're really uncomfortable, please call the office and let them know. We can get a prescription out to you that way as well. You may also notice a little bit of bruising around the incision sites, the penis or scrotum, or the area between the scrotum and the rectum. That is all perfectly normal. Those are the areas where Dr. Patel just did surgery. You may also notice a little bit of oozing from the incision sites. That's perfectly normal as well. You can take a little piece of gauze, put it on the incision site. However, if that oozing looks like pus or the incision sites are red, warm to the touch, please call the office to let them know. We would worry about an infection at the incision site. You may also notice some swelling in the penis or scrotum. Sometimes the gas can escape into that area as well. So if you do have swelling, you must wear tight undergarments. So boxer briefs, jock straps, something that's going to lift and support that area. If you're sitting down, lying down, you can roll up a washcloth, put it underneath the scrotum to elevate it, and use ice. If you do not have any swelling, you can wear whatever is comfortable, even if that's nothing. So now let's talk about the catheter in the bag. Right now you're going to notice that your urine is still pretty pink tinged. That's perfectly normal. We just did surgery. The more fluid that you drink, the more you'll notice that it is clearing up, looking like normal urine, which should start happening this afternoon. However, after you walk around, move around, have a bowel movement, even after the catheter comes out, that urine will darken back up a little bit. That is perfectly normal. Just make sure that you're drinking the volume of fluid and it will clear back up. If, however, you are noticing that it is not clearing back up and you're drinking the volume of fluid, please call the office to let them know. When you get home, the only time that you're going to pay attention to the amount of urine in the bag, you do not have to measure it. But if you're sitting there, your bladder's feeling really full, you're not seeing a lot of urine in the bag, the first thing I want you to do is get up and walk around. Sometimes what happens when you're sitting there, there can be a kink in the tubing inside the blue bag, or there could be a small clot blocking the catheter. When you get up, walk around, that tubing will correct itself, gravity will flush out the clot. However, if you're noticing after walking around that is not fixing the problem, you're still feeling really full in the bladder, you're still not seeing a lot of urine in the bag, please call the office and let them know. There may be a larger clot in the catheter that we have to flush out. Now, you will also see some small blood clots. They're going to look like little flecks of sand, little flecks of gold, once again, even after the catheter comes out. Also, please make sure that you're examining the tip of your penis for any leaking. A little bit of urine, a little bit of blood is perfectly normal. You will see some spotting, and I'll show you why that's perfectly normal in just a moment. However, if you're soaking your underwear, you're soaking your outer garments, please call the office to let them know. Now, as I mentioned earlier, in the bag of supplies, there is an option for wearing a small leg bag. It comes in a package, looks like this. You will have to take it out and put it together. And by putting it together, I just mean the straps have to go through the holes, and the straps do close with the little white buttons. Before I show you how to swap out the bags, let me show you the catheter itself. So this is what the catheter actually looks like. So when you look at your right thigh later, you will see this little white adhesive pad. This pad is not what is holding the catheter in place. Its only function is to keep the tubing attached to your leg, so it's not just swinging free. If the pad starts coming loose over the next couple of days, don't panic. You can just go to the pharmacy, pick up some paper tape, and tape it back down. What is holding the catheter in place is this little balloon. It sits at the base of the bladder and holds it in place. However, it is not an airtight seal, so it can move around a little bit, which is why you will see some spotting of urine or blood. And of course, we will deflate the balloon before we take the catheter out. Now, the setup that you currently have looks like this. You have the large bag, which is going to be attached to the catheter. And when you look at your right thigh, you will see the one little tube that's not attached to anything. That is what we use to deflate the balloon. Now, if you only use the large bag, the only thing that you need to know how to do is empty this bag. So please do this with your nurse before you leave today to make sure that you are comfortable doing it. So what you want to do, standing over the toilet, it looks like a little green clothespin. You're going to pinch it, pull the tubing loose. When you look at the clamp, you'll see there's a little indentation on it. You're going to push down on that and it will pop open. When you do that, make sure that you're standing over the toilet because it will immediately start draining. Once it's drained, you're going to pinch the clamp back together, and when you hear it click, it's clamped. Once that's done, you can clean the tip of it with an alcohol wipe, and it goes right back into the little holder. If you choose to use the leg bag to swap them out, what you want to do, wash your hands and put on some gloves. And this is the only time that you need to wear gloves. You do not have to wear gloves to empty the bag. We do because it's not our urine. So wash your hands, put on some gloves. You're going to take a towel, put a towel between the tubing and your leg. Hold on to the catheter, pull out the clear tubing. You will get a little bit of urine leaking from the catheter, but that's why we have you put down a towel. When you look at the leg bag, it's going to be labeled top. The top part is what you're going to clean with an alcohol wipe. Once it's clean and dry, it goes into the catheter tubing and stays in by suction. The top strap is going to go at the top of your thigh. Bottom strap is going to go either right above or right below your knee. It's just going to depend on where it lands on you. Now the leg bag only holds about a half a liter. The big bag holds 2. So this has to be emptied much more frequently. With the volume of fluid we have you drinking, most of our patients tell us it has to be emptied about every hour to an hour and a half. Now our rule of thumb for both bags is to not let either one get more than 3/4 of the way full before you empty it. Both of these bags only hold a certain amount before either 1, the urine starts backing up into the tubing, or 2, they break. Neither one is a situation you want to deal with. So to empty this bag, you're going to go to the toilet, you'll undo the bottom strap. You'll see there's a little cap at the bottom. You're just going to pull that off. Once it's drained, clean it with an alcohol wipe and put the cap back on. Now if you use the leg bag, these bags must also be washed out between each use. And that has to be done every time the bags are changed. So if you're swapping out multiple times throughout the day for napping or any other reason, they have to be washed each time. So to do that, you're going to take a little bit of soap and water or vinegar water solution, 1 part vinegar to 3 parts water. You're going to put enough inside the bag, slush it around, and drain it out. Now if you use the leg bag, you must switch back to the big bag at night, and we encourage you to switch back to the large bag when you come for the catheter removal visit. So to swap the bags out, it's the same process in reverse. Wash your hands, put on some gloves, put down a towel, hold onto the catheter, pull out the bag. When you look at the clear tubing for the big bag, you will see that the tip of it is tapered. This tapered part is what you're going to clean with an alcohol wipe. Same thing, when it's clean and dry, it goes into the catheter tubing and stays in by suction. Once again, if you only use the large bag, the only thing that you have to do is empty it. There's no washing, there's no cleaning, there's no disconnecting.
Hello, my name is Vladimira Viova, and I'm Dr. Patel's nurse advocate. Today, I will let you know what to expect at your catheter removal appointment, as well as when and how to call the office once you're at home. I do think it's important for you to know when and how to reach the physician on call. Our normal business hours are 8 a.m. till 5 p.m. Eastern Standard Time, Monday through Thursdays, and 8 a.m. till 1 p.m. Eastern Standard Time on Fridays. If you're calling during business hours, your call will be redirected to the clinical team. If you call outside of these business hours, you will be directed to our on-call emergency line. When you call that number that you see on the screen, you will wait for the prompt to speak to the operator. The operator will take down your information and message to pass to the physician on call. That way, the physician can reach out to you as soon as possible. Reasons to call include having a fever or a temperature greater than 100.5 Fahrenheit, if you're vomiting or extremely nauseous, if you've had no bowel movement after 5 days, if you're having unrelieved pain, If there's little urine in the bag with the bladder feeling full for more than 4 hours, if your incision sites are oozing a pus-like liquid or are red or warm to the touch, or if you're leaking profuse amounts of urine or blood from the penis. If there are any acute changes in condition, such as chest pain, shortness of breath, fainting, signs of a stroke, please call 911 or report to the nearest emergency room, as these need to be addressed as soon as possible. Now, what to expect at your catheter removal appointment. Please be prepared that this will be a longer visit and will take place at Dr. Patel's office. Please make sure you read over your discharge paperwork as Michael advised to best prepare yourself for this visit. First, you will be taken to a procedure room and a cystogram will be completed. A cystogram is an X-ray that will let Dr. Patel see whether the catheter is able to come out safely. Pending results of the cystogram, if the catheter may be safely removed, clinic staff will take you to an exam room and begin the removal process. They will detach the clear tubing from the catheter, and they will take a syringe with about 150 milliliters of sterile water, and they will attach it to the catheter tubing and instill that into the bladder. Then they will deflate the balloon and have you take a deep breath. When you take a deep breath, they will remove the catheter. This is not a painful process, but it is an odd sensation. Once the catheter comes out, they will have you urinate into a plastic urinal to make sure you're able to urinate on your own. You will then be given a couple of male undergarments to wear out of the office and take with you. We know that continence is a work in progress, and we don't expect for you to have any control of your bladder at that time. During the catheter removal appointment, you will also get your pathology report and discuss penile rehab and incontinence education. If you did Kegels prior to surgery, make sure you do not do Kegels with the catheter in place. Kegels will restart 7 days after the catheter is removed. Now, you will be scheduled for your next follow-up visit and given lab orders for PSA. You may be given orders for a pelvic ultrasound if indicated. Both will need to be completed prior to your next scheduled follow-up visit. Lastly, if it is advised that your catheter remain, your provider will discuss with you the next steps. Now, if you live 2 hours or more away from Advent Health Celebration, it is strongly advised for you to stay overnight the day your catheter is removed. There's a small chance that any patient may go into urinary retention, which is diagnosed when you go 3.5 to 4 hours without any dribbling or dripping of urine into your undergarment or toilet, but you still have the sensation of needing to urinate. The treatment is to reinsert the catheter to relieve the bladder. If you're unable to stay nearby and this happens, please call the office first so you can be assessed. If you've gone to an emergency room for any reason, especially if it's not an Advent Health facility, please call the office first to inform Dr. Patel and the team. On behalf of Dr. Patel, Michael, myself, and the rest of the team, we thank you so much for letting us be a part of your care.